So, good evening, ladies and gentlemen. Thank you for coming out tonight. My name is Sylina Levy, and I'm the organizer of this event. I'd like to thank our sponsor for this event, which was the Republican Women of Westport. In particular, I'd like to thank the president of the Republican Women of Westport, Senator Judy Friedman. Judy Friedman is unable to be with us tonight because her husband is very ill and he's hospitalized. I'd also like to thank the doctors here today for their gracious time and public service. They'll be introduced momentarily. So welcome everyone to It's My Health, How New Healthcare Changes Are Affecting the Practice of Medicine in June. Tonight we have planned an exciting evening of discussion, questions and answers, perhaps helping you to think about the impact of the new healthcare law and its direct effect on you, which in turn may produce even more questions. Our goal is to dispel much of the confusion over the new healthcare law and discuss the changing medical environment. Our moderator tonight is Dr. Jennifer Weider. Dr. Weider is a nationally renowned women's health expert, author, and radio talk show host. She is the author of 3 books, a 4th in progress, and has published articles in the New York Times, Cosmopolitan Magazine, the Wall Street Journal, Prevention Magazine, and many, many others. Dr. Weider is a spokesperson for the Society of Women's Health Research, the nation's only nonprofit organization whose mission is to improve the health of all women through research, education, and advocacy. Dr. Weider will introduce the panel. Please help me give a warm welcome to Dr. Weider.
I'm a little shorter. Hi, thanks so much for coming. It's a tremendous honor to be here, and thanks so much to Sylina for her incredible effort really in putting this together, and her wonderful advertising, which we saw the signs all over town, which was great. We have a tremendous panel tonight, a really incredibly educated, articulate, intelligent, wonderful panel, who I wish I had the privilege to go out to dinner with. Maybe we will afterwards. Not tonight, though. Let me just introduce to I don't usually need a microphone. I'm just going to start by introducing the panel, just to let you know a little bit about us, and then we're going to talk a little bit today about how healthcare changes are affecting us, how they're affecting doctors, how we think it's affecting the practice of medicine, how some doctors aren't even aware of what changes are to come down the pike, and how we think it's going to affect us 2, 3, 4, 5 years down the road. We're all in this together. When I was in medical school, most of the people that I went to school with went to medical school in order to help people, in order to benefit the health of their patients. They were in it for the right reason, filled with altruism and optimism, and things have changed quite a bit. And I'm going to talk to you a little bit about a survey about how doctors' attitudes are changing and what's going on from the perspective of the doctor. And then the doctor is going to talk a little bit about the perspective in their own practices, hospital-based practices, private practices, and policy changes that are going to affect the patients. So to begin with, Dr. Scott Gottlieb is a practicing physician and resident fellow at the American Enterprise Institute, a private, nonpartisan, non-for-profit institution dedicated to research and education on issues of government, economics, and social welfare. Dr. Gottlieb is the author of more than 300 articles that have appeared in leading medical journals, as well as the Wall Street Journal, New York Times, USA Today, and Forbes magazine. Dr. Gottlieb and I went to medical school together, and in between him dissecting cadavers, he was writing diligently and arduously at his desk, and was published constantly, and he's just amazing. So it's great that we're reunited here. Dr. Alice Chen, also a wonderful physician, is a duly board-certified and fellowship-trained physiatrist and interventional specialist in the non-operative management of spine and sports disorders. She treats disorders and injuries of the neck, back muscles, and joints in a minimally invasive manner using techniques including epidural injections, blocks, radiofrequency ablation, joint injections, and medical acupuncture. I can define all of these words if you want, big words. She employs techniques using ultrasound guidance and fluoroscopy guidance to enable accurate treatment of deeper structures. And that's Alice. Dr. Evelyn Cusack is active in the American Heart Association Go Red movement, regularly giving lectures. She is also involved in the American Cancer Society's Relay for Life in Greenwich and now in Weston. Dr. Cusack maintains a cardiology practice in Stamford with the Heart Physicians, an affiliate of Stamford Health Integrated Practices. She's the Director of Community Outreach for Stamford Hospital and Stamford Health Integrated Practices. She graduated from the University of Massachusetts Boston with a BS in chemistry, and she obtained her medical degree from the University of Massachusetts Medical School. Her internship and residency were at Brown University Rhode Island Hospital in 2001, and she completed her cardiology fellowship at NYU. She's now living in Connecticut, just like the rest of the panel. So as you can see, many of the panel's incredibly well educated and well versed to speak tonight. Rosa Feeney, Dr. Rosa Feeney, who just joined us at the last minute, lucky for us. She received her medical degree from Georgetown University, and she interned at the State University of New York at Syracuse and completed her training at the University of Maryland. On moving back to the Northeast, she was a pediatric emergency room attending physician at Montefiore and North Central Bronx Hospital. She entered private pediatric practice in Fairfield in 1996, and she currently resides in Greenwich, where for the past several years she has been a stay-at-home mom raising 4 children, enabling her time to read the healthcare bill, which she just completed reading after 4 years. So our panel is quite diverse. We have someone who's an expert in policy. We have primary care doctors. We have specialists, and they're really here to answer a lot of questions. Just to start, I just had gathered some information about how the healthcare reform is going to affect us, and just a little background information on what changes are coming and when they're going to be in place. And in addition, I found a survey of Americans' physicians' practice patterns and perspectives, and it surveyed physicians about their feeling about practicing medicine today. One of the interesting things for me, because I'm a journalist, I'm currently not practicing, is that there is such an incredible exchange of inaccurate information. People don't know what is going on, from patient to doctor to insurance company. They're not sure what changes are going to take place and when. And it can be very confusing for both the patient and for the doctor. So we're going to try to do a reality check tonight and just, at the best of our ability, give you a clue of what we think is coming down the pike. So, to begin with, the provisions are going to begin soon, and here are some of the changes that are going to be made. Starting this year, children up to the age of 26 will be allowed to remain on their parents' health plan. People with pre-existing medical conditions would be eligible for a new federally funded high-risk insurance program, and small businesses could qualify for tax credits up to 35% of cost premiums. So even reading through this as a doctor and the education that I've had, it becomes a little confusing just with some of these, some of the wording of this bill. And I've gone through I've gone through much of the bill, and it's incredibly perplexing. So it's a little confusing what's going to happen. In 2014 is when the main reform changes are going to kick in. That's when the insurance marketplaces would be set up in the states to offer competitive pricing on health policies for individuals and small businesses that don't have coverage. People with pre-existing conditions will no longer be denied coverage, and all lifetime annual limits on coverage would be eliminated. So starting in 2014, a person who did not obtain coverage, if we don't get coverage, if you choose not to get coverage, there is going to be a penalty in 2014 of $95 or 1% income, whatever's greater. And that's going to rise in 2016 to $695 per individual, or 2.5% of the income by 2016, and then it's going to go up a little bit after that. So there's going to be a penalty if you choose not to buy